Today we are going to look at the problem faced by the United States and Singapore with regard to the aging population. In the United States, the elderly population has been increasing, and yet the doctors, nurses and caregivers are stagnant or falling. The author's view is applicable as life expectancy has been increasing over the years, and the elderly population is increasing as shown. Also, demand of doctors, nurses and caregivers will increase. The two pie charts also shows that Singapore has lesser doctors compared to America. However, the number of doctors and nurses recorded has been increasing over the years, while policies like Medisave and Medishield are implemented to help the elderly. Hence, the author's view are applicable to the Singapore society, as it's a fact that we are facing a greying population. The increase in policies, doctors and nurses are not enough to help us face the problem, as we will not tackle the root of the problem, which is to meet the demand of the healthcare for the elderly. Hence, the author's view of we are not prepared for aging population is applicable to the Singapore society. The next problem is the lack of skilled and untrained geriatricians. For Singapore, it could be seen that most of the geriatricians have little experience, and geriatric rehabilitation has not gained much recognition. In the year 2003, there are only 32 geriatricians in Singapore, and that students do not get to gain a lot of experience while in school. However, there's advancement in the studies of geriatric as more courses have come up in NUS and NYP. Therefore, I believe Singapore faces the same problem as America, as one is unable to pursue the study of geriatric in Singapore, and the research in geriatric medicine is limited. Students are also deprived of the chance to experience real-life situation as internship is kept to the minimum. Though courses have started to come up to improve the situation, it came rather late as many physicians do not have the knowledge of it. Hence, the lack of skilled geriatrician is applicable to Singapore.
Moving on, in America, the author believes that health disparity exists. What about in Singapore? It seems apparent in Singapore because, as the table shows, Medisave does not extend beyond immediate family members, and permanent residents are disadvantaged when it comes to subsidies. However, it is not applicable to Singapore, as the graph on the left shows that a large percentage of people are able to and do use Medisave for healthcare services. Separate funds such as Elder Fund and Elder Shield are formed to cover more fundamentals in supporting the aging population. All in all, health disparity is rare in Singapore, as the government had come up with policies which ensure that health disparity is kept to a minimum. In the author's view, training of medical students in the geriatrics field in America could be improved. Does that apply to Singapore? The UN has identified the training and education of healthcare professionals and care providers involving older people as a global priority. In Singapore, teams of organizations such as the Department of Geriatric Medicine in Changi General Hospital have come together to improve training and facilities to adapt to the changing needs of the elderly. Although it is a fact that older people have many medical needs of varying dimensions and their care requires a multidisciplinary healthcare team, Singapore Healthcare has put in place systems to monitor the training of specialist geriatricians and departments that help to ensure that the elderly are physically, mentally, and financially taken care of. To conclude, the authors stand that medical training in the geriatrics field is inadequate in the United States is not applicable to Singapore, as it has come up with schemes in dealing with the issue. The author states that not all aspects of an aging population are well taken care of. In Singapore, policies such as Medisave are being implemented but only cover 84% of population, hence not everyone is being covered. On the contrary, in Singapore, from services such as the Seniors Helpline and programs such as SPICE and wellness programs, it can be seen that not only the financial but also overall welfare of an aging population is accounted for. Although there are still some loopholes when it comes to healthcare policies to aid ecology of aging in Singapore, these policies provide a wider parameter in caring for an aging population. Thus, the author's view is not applicable, as Singapore's healthcare provides a holistic approach to aging population and ensures that the elderly ages gracefully, thus providing a more all-rounded strategy to counter aging population.
All in all, the fact that the United States need an improvement in terms of healthcare to deal with its aging population is not applicable in Singaporean society. Singapore's healthcare has already adapted to the rapidly increasing number of the elderly and has taken measures to cater to the changing needs of the population. To ensure that health disparity is kept to a minimum, the 3 M's are introduced. Despite the fact that one is given little opportunities to pursue the study of geriatrics in Singapore and research is limited, systems such as the Geriatric Medicine chapter of the Academy of Medicine allows the training of more geriatricians. In addition, Singapore's healthcare provides a holistic environment for the elderly to adapt, unlike the financially driven politics in the United States.